Good evening. I'm very sorry I couldn't join you in class today. This is Dr. David A. Padgett, Associate Professor of Geography and Director of the Geographic Information Sciences Lab at Tennessee State University. Among other things, I am largely credited with being the first academic to map Nashville's food deserts using geographic information systems. I'm going to take you on a brief tour through a little bit of the history of my involvement with food deserts mitigation, including some service learning outreach activities. So I'm going to open up a PowerPoint presentation at this time. Well, first I will share my screen. And then I'll open up this PowerPoint presentation, which is entitled Investigating Food Deserts with Inner City Service Learning Projects. So it's a combination of my experiences in food desert research and mitigation here locally, and some examples of how students perhaps can get involved in this type of work. So first I'm going to play a brief snippet from an interview that I did a few months ago, just to give you an idea of some of the current things that are happening with food deserts in Nashville.
Luxury. Getting fresh food quickly may not seem like it a luxury, but Fox 17 is investigating this problem this morning, and the food deserts is the topic. The urban or rural zones all around Nashville where our neighbors don't have easy access to fresh fruit. So joining us this morning, we have Dr. David Padgett from Tennessee State University. Thank you for coming in. You're here to talk a little bit about the problem that we have right here in the mid-state. And when we look at these food deserts and the challenge of getting fresh, nutritious food to a lot of folks here, what's the first thing that comes to mind to you as the impact here in the mid-state?
Well, the biggest impact is upon health. I mean, that's the most serious impact. It's not just that people are inconvenienced and can't get to the store. Maybe it takes them longer to get to the store. Actually, when people live in food deserts, eventually it impacts their health negatively. Having a lack of fresh fruits and vegetables in one's diet obviously is not a good thing.
Sure.
And especially for children, you know, because children have no control over where they live. Then they're almost a captive population within these geographies.
What are some of the zones that people might recognize if you listed off some food deserts in the Nashville area?
Well, there's one that's close to the J.C. Napier homes. There's another one that's in the area of the Sam Levy homes in Casey area. There's one in North Nashville, as a matter of fact, very close to Tennessee State University. So they're essentially right around the inner ring, around the 440, excuse me, not 440, 40, 24, 65 loop downtown.
But also these food deserts exist in rural areas, right?
Oh, yes. There are rural areas that have food deserts, largely because of people live in remote areas and the food retailers don't find those places to be profitable. And if a person is elderly or just doesn't have transportation in the rural area, it's very difficult. But we also have suburban food deserts because we know that poverty has largely shifted to the suburbs.
Sure.
And even here in Nashville, in Madison, and Antioch, I've found some suburban food deserts.
Okay, right, in Antioch. I mean, Antioch seems like a place where you'd have a lot of folks and a lot of access. So one of the things we're talking about this morning, too, is the solutions. Quick question before I let you go. Is the solution to this as easy as just building more grocery stores?
Yeah, that's one solution. You have to find retailers that are very interested in social entrepreneurship, who to some degree can find a way through organizations such as Uplift Solutions Incorporated to overcome the barriers of locating any business in a low-income area. And the second is transportation, improving especially public transit. That's the biggest barrier.
Well,
no car, no food.
Yeah, we got a lot of plans in the works right now with Mayor Megan Barry to try to solve some of those transportation issues. So Dr. Padgett, thank you so much for coming in this morning to talk about the topic.
Okay, so I thought I'd just share that that brief presentation with you. Like I said, it was a little while ago, but it kind of gives you a better idea of exactly what the current status of food desert issues are in Nashville. So now I'm just going to take you very quickly chronologically through this food deserts mapping experience I've had for the last 15 or so years. It started out with one of my students. Well, actually what happened was about 15 years ago, the organization tying Nashville together, otherwise known as TNT, which was an interfaith non-denominational coalition of faith-based organizations. They were doing a grocery store survey. They were looking at whether grocery stores in all parts of Nashville were providing equal service to their customer base, with the suspicion being that those in lower income or African-American communities or Latino communities were perhaps underserving the population by not providing quality service, by not providing quality and or safe food products, and so on and so forth. And so out of that activity, I was approached by TNT and asked to map the results of their survey. I went further and had one of my students enrolled in my cartography class. Cartography is art and science of map making. I had her produce the map you see here, which essentially, through just a casual eyeball observation, displays clearly that there aren't a whole lot of supermarkets near where African Americans live. Where you see less African Americans per census tract, see more supermarkets. When you get here in North Nashville, Bordeaux, only really 4 supermarkets visible. When we say supermarkets, we really mean a grocery store that has fresh fruits and vegetables, all the amenities you would expect to have in a large full-service store, along with obviously good service and reasonably priced products. I began to notice that there were some areas in Nashville that really were far away from easily accessible grocery stores or supermarkets. As you can see on this map, they are primarily around the inner ring suburbs. So my basic methodology was to look for areas that had relatively low income, followed by looking at census data with regard to private vehicle ownership in those communities. So if you had a lower income community that also had a high or significant portion of the population without private vehicles, then the assumption is that that community would be transportation, would be prohibited in terms of their mobility. And then I looked at a 1 mile straight line radius from the centroids of those communities to see if there were any large or major grocery stores within that radius. And as you can see with this community here in East Nashville, if you took a approximate 1 mile radius around there, there aren't any major grocery stores anywhere near either one of these two food deserts. And then you couple that with significantly high numbers of households without automobiles, and you can clearly see how these communities could be defined as food deserts. Now, this map actually is from 2009. The food deserts here were identified in 2004. This map came from a study I did with Dr. Heather O'Hara at Meharry Medical College, and she is a nutritionist. And we were trying to look at the relationship between the food deserts and health. But our research and other research shows that there's not really a significant difference in obesity with regard to food deserts, but we do find that people in these communities consume fast food at a higher rate than others, and we know that fast food basically is not good food. Here's a map that I created through research with Dr. Heather O'Hara from Meharry. Here is the Edgehill Homes Food Desert. And you can see that we have fast food stores all around. But if you look at the food desert itself, here are numbers representing the body mass index, BMI, inside the food desert, 26.3, 27.8. Then outside the food desert, the numbers are relatively the same. And that's largely because at that time in 2009, Tennessee had one of the highest rates of obesity and overweight citizens in the United States, if not the highest. So it really didn't matter whether a person was inside of a food desert or outside of a food desert. Obesity and overweight issues were going to be present regardless. But we still did find a significant number of fast food establishments in and around these geographies. Moving further, one of the proposed solutions or mitigations for food deserts was to provide those convenience markets or under-resourced food stores with the capacity to sell fresh fruits and vegetables and other healthy products, because it was not that these convenience markets did not desire to provide those products to their customers, they just didn't have the capacity. So with the Community Food Advocates Corner Stores Project, which was a federally funded project, these stores were provided with the items so that they could sell fresh fruits and vegetables and so on and so forth. Now, with this, what you're looking at in this map is our identifying or using GIS to identify the markets that would participate in this corner store program, because we would not want people to just go out willy-nilly and just pick out any stores. We wanted stores that were either in the food desert or stores that were within a quarter-mile radius of the food desert. So we use in geography what's called a select command along with a buffering command to select out the data, the stores that would fit the criteria for being good candidates for this corner store program. Largely, this program and other programs like it revealed the fact that, in general, people in food deserts don't normally buy their food or buy their groceries from these convenience markets. Maybe if you run out of milk, and you might run to the convenience market. If you run out of eggs, you might run to the convenience market. But for really family grocery shopping, people in these communities want to shop at the same places that everyone else shops who might happen to have a car. And so those people in food deserts oftentimes are just challenged to get to these grocery stores, but they will, they'll get a ride from a relative, get a ride from a friend who has a car. But we find that they're definitely not eating at convenience markets, and definitely are just finding ways to get to mainstream stores. So that's when transportation becomes an issue, or maybe a mitigation would be to improve transit so that people can get to where they want to shop. However, we know that public transit is a challenge here in Nashville. I think just last week, the Music City Riders Union uh, produced a report card on Nashville's transit, which basically gave low grades to the MTA routes serving low-income communities, but relatively high to acceptable grades to the bus routes that were serving more affluent communities, which really is interesting if you think about it. You know, the people that need public transit the most have the best buses, the safest buses, the cleanest buses, the most reliable buses. The people that need public transit the most have lower quality service. Very interesting. So moving to 2013, I was approached by the Nashville Civic Design Center, and the question was, are there food deserts in suburban areas? And so, as I mentioned in the presentation earlier, that is certainly the case because largely poverty has shifted to inner ring suburbs and cities all over the United States, whether it be via Section 8 vouchers or just people being priced out of gentrifying neighborhoods in the inner city. Both of those dynamics were happening here in Nashville, and I did indeed find a prospective food desert in Antioch, which in Nashville could be defined as a suburb of the General Services District, which was the old boundaries of Nashville or the city of Nashville prior to the city and county merging in 1963. So what is or is not a suburb is somewhat tricky to define here because of our city county governing geography here, but we can still say that these places in Antioch and Madison are outside of the urban core. And you can see here these dot symbols represent a household without a vehicle. And you can see there's a significant concentration of those households and no grocery store within a straight line mile distance of any of those carless households. Getting more into our service learning approach to mitigation, a few years ago, I was working with Pearl-Cohn High School. You can see the demographics of Pearl-Cohn. I think Pearl-Cohn now is 100% free and reduced lunch program, probably the same percentage of African-American students, if not higher. So via a series of grants from State Farm and HUD and other sources, we developed a geographic information systems program at Pearl-Cohn High School. And my students who were enrolled in my geospatial issues and environmental security class were required to engage in a urban food desert awareness project with these students. And so with this project, we asked the students to just go home, bring some products from where you are, from where you have been shopping, and then take the locations on the label of those projects so that they can map their food footprint, if you will, in an ArcGIS map. And you can clearly see the students were probably very surprised to see that their food comes from literally all over the world to right here to their table in Nashville, very significant distances away from their homes. And of course, this issue of out of season or imported foods to some degree exacerbates food desert issues because, of course, when we start to get food from a variety of sources, it drives up the cost so that even if a family does have access to a grocery store, perhaps due to the added cost of transit and transportation of these goods, the price may become prohibitively high. With this map, we queried the students with several quick questions. We asked them, well, which grocery store does your family visit most often? How many days you eat fast food per week? how many days you go grocery shopping per month, and then finally, how far does your family normally travel to get to the grocery store? And we made several assumptions. One was that the further a family traveled to get to the grocery store, the more likely they would be eating fast food uh, as a matter of convenience, especially a family that has children, they're hungry, you got the dollar menu right there. Let's go over and get something on this dollar menu as opposed to trying to find a way to get to the grocery store to get maybe something that's fresh and healthy. And so this is a somewhat complex map. We also have a layer of food expenditures outside of the home with the presumption that people who are in food deserts would spend money at restaurants or fast food as opposed to going shopping and preparing food at home. And we see that there's somewhat of a correlation between those families eating fast food per week, shown with these dot symbols, and the areas in red where people spent a significant percentage of their money outside of the home. So the students really got to see how we can add data to an existing map and make gross assumptions, or really educated assumptions, about what might be happening in these food deserts. We also got a small grant from Google, and with this Google grant, the students were asked to develop a map that would answer a question. In this case, how is the distance we live from local grocery stores related to our grocery shopping and fast food eating frequency? And again, students really asked to question whether or not their juxtaposition relative to foods that have, or stores that have fresh fruits and vegetables, actually push them into a situation where they had no choice but to have a less than desirable diet. And this just raises a lot of questions for young people, because it really gets them at a young age to begin thinking about urban food equity and perhaps ways to mitigate that. And so here is just a rough scatter diagram that we created. Again, we assumed that the farther students were away from the store, that we would see fast food consumption increase with distance. Notice we really didn't see that. Another thing that was surprising is that we asked the students how their families got to these grocery stores, and every last one of them said that they got there by private vehicle. We assumed that they might get there on the bus, maybe walk, maybe, but not 100% private vehicles, which really speaks to the fact that people are going to get to regular grocery stores, not shop at convenience markets. And it was interesting. One of the most popular places for people in North Nashville around Pearl High School to shop was the Super Walmart, which is a pretty good distance out Charlotte Pike. Pretty good distance. I think it's around maybe 8 or 9 or miles or farther to get to that particular grocery store, because that's where they wanted to shop, even though there is a Kroger in North Nashville. I'm not sure if the Save a Lot had opened up in North Nashville yet, but the preferred shopping center for food was Super Walmart, probably for price reasons than anything else. So most recently, for the last 4 years, I was involved with the Reach 2020 project, which was based at Meharry Medical College. Dr. Hargreaves was the principal investigator, and Sam McCullough, who is pictured here, who may or may not be in your class, and Taylor and Lewis, who were community organizers working on the project. So this food desert mitigation project had its primary goal to bring food to the people through the establishment of temporary grocery stores, for instance, or temporary grocery markets would be a better term, established at community partner organizations in North Nashville within these food deserts. And so these happen to mostly be faith-based organizations. My role in this project was to use GIS to map the locations of the community partners, and then through data visualization, symbolize the number of individuals served. And so from approximately 2014 to 2017, this project was attempted to bring some form of mitigation or a model for food desert mitigation through these urban markets. It proved to be somewhat challenging. The food business is a very narrow profit margin business. And so even when we subsidize vendors to bring food into these communities, we found that the costs associated with this these market sites oftentimes exceeded what these vendors were willing to take on. And so even with the subsidy that we provided from the grant, oftentimes the vendors found a hard time to stick with us. And so again, it presents a challenge. I mean, we could have the best of intentions and have people who really want to be involved in food desert mitigation, but if the economics of the model just aren't feasible, then it's very, very difficult. And so that's the reality of the situation. After the Reach 2020 project ended, the Centers for Disease Control challenged the Meharry and the rest of us to come up with a sustainability plan. In other words, what type of mitigation would last beyond the life of the grant? And so with my urban geography class in spring 2017, one of their assignments was to use GIS and other research methods to get a gross estimate of the amount of vacant land available in North Nashville, and then further, what is the potential for those vacant properties to be converted into urban gardens, or the potential for abandoned buildings to perhaps be converted into indoor urban greenhouses. That way we could have food produced for local markets 365 days per year, regardless of the weather. And so we did find that there's a substantial amount of land that is available in North Nashville, and we were somewhat modeling our approach after what's happening in Detroit. If you look at what's happened to Detroit, Detroit has lost more than half its population over the last 50 years. There used to be 2 million people in Detroit. Now I think there's less than 1 million, significantly less than 1 million. So there's a lot of empty land in Detroit. But what's happened is that empty land is now being converted into a massive urban agriculture project. It might be something that you might want to look into, is what's happening in Detroit, what's happening also in Milwaukee, what's happening in Atlanta with Truly Living Well. So there are several examples of where urban gardens are being developed on abandoned or vacant properties, turning these perhaps eyesores or perhaps blight on the community into assets where not only people can provide food for communities and perhaps for local markets, but also give communities a chance to come out and interact with, maybe young people learning from elders, how to garden. I mean, if you ask the typical young child today in the inner city where a potato comes from, he's probably going to say Kroger or Save-A-Lot or Super Walmart, and have no idea that that product came from, that potato came from out of the ground. And so that kind of interaction is what young people need, so that they can have a greater appreciation for the source of their food, so maybe that they can, next generation can move forward and get into active food desert mitigation measures, starting from the grassroots in the youth. Also, we looked at bringing in a social entrepreneurial organization, in this case, Uplift Solutions. What Uplift Solutions has been doing all over the country is they've been developing urban grocery stores in places where mainstream grocery stores have completely abandoned the community. And so food desert mitigation is not as simple as just putting a grocery store in a food desert community. It's a lot more complicated than that. There's an educational process. So what good would it be for us to have a food or a grocery store established in one of these communities and have the people go in there and buy the same unhealthy, fatty, processed foods that are contributing to their poor health in the first place? Or also, what if you said, okay, well, we're going to put a store in this community that has healthy foods, fruits and vegetables, and yet the people won't buy them because they're just so conditioned or used to eating foods that might not necessarily be healthy. So there's an educational aspect to this where not only do you bring food, improve food access, but you also improve people's habits. And as we know, human behavior is very difficult to regulate when people have free will and free choice. And so what Uplift Solutions does is that even before the food store or grocery store is built, maybe a year before, they do a market area assessment. They go and they actually talk to people. Talking to people is not something that is normally done in market research, especially with regard to grocery stores. It's all done with data and numbers. But Uplift Solutions goes in and asks people, okay, well, what do you want? What kind of grocery store do you want in your community? And there's direct input from people in the community. And so that by the time the store is built, there's already community buy-in because there's been a participatory process in developing that store. And these stores tend to be very successful all over the country if you Google them and look up Uplift Solutions. We are still trying to get Uplift Solutions to do something here in Nashville. We haven't been successful, but we're definitely trying. It's something that perhaps, I don't know, a class project, get Uplift Solutions to the table in Nashville and see if we can get perhaps a store in Edge Hill, or Uplift Solutions to build a store in East Nashville or someplace like that. But that's just the continuing. The struggle continues. The work continues, and as Nashville's urban core continues to gentrify even more, and as lower income people get pushed farther and farther out in the suburbs, and we start to see grocery stores continue to close in these marginal communities, this is a problem that is not going to go away. And again, the people that suffer the most are children who need healthy food as they're growing, as they're developing. And so it's not necessarily a matter of convenience. In some cases, it's a matter of life and death in terms of the types of health issues that people in food desert communities are suffering from, diabetes being just one. So thank you for your time and attention. If you have questions, please feel free to contact me. I'm very sorry I could not be there today. Dr. Bandy is a great friend and colleague, and I really would have liked to have been there today. Hopefully this will suffice, but it's the best I can do. And again, if you have any questions, please feel free to contact me at the email address there. And hopefully, perhaps I will get to visit at some other point during the semester. Who knows? Thank you very much.